production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Thank you for tuning in for this episode of Being Well. I'm your host, Key-Ann Armstrong, and it's all about the heart today. We're talking with cardiologist Dr. LaMonto with Sarah Bush Lincoln Health Center. Thanks so much for joining us today.
Thank you very much. Thanks for having me.
Yeah, so lots of people are interested in the heart and heart disease, and you were too at one point in your life. So I want to know, when you became a cardiologist, what brought you to Sarah Bush?
Well, that's actually an interesting story. I was actually an emergency room doctor here at Sarah Bush since 2005. And in 2011, I had a motorcycle accident that I had a bad injury with my leg and my shoulder and a long rehab, and it was evident that I wasn't going to be able to do emergency medicine anymore because it's a very physical job. So I had to do something else with my life. So I went back to school at the age of 43, which was not great.
A little
it was not fun, a little challenging,
age.
Yeah. But went back to school for 3 years for cardiology, and now I'm back. And I always wanted to come back to this area because this has been my wife and my home, and we consider this home for us. I was raised in Chicago, south suburbs, but this is our home. So,
right.
But cardiology was actually it's a very fascinating field. It has to do a lot with physics and hemodynamics and fluid mechanics and things like that. So if you have any interest in physics at all, when combined with medicine, it's actually a very nice combination. So.
Yeah, so that's what got you interested, and
Yep.
I can tell you're excited about it.
Yep.
So I'm sure patients get that when they come to see you for their problems. You probably help lighten that anxiety for them.
That's a big part, and that is actually something that I learned when practicing emergency medicine, because everybody that comes in is scared and tense, and that's a skill that you kind of learn dealing with people on a day-to-day basis in stressful situations, to just take a breath and diffuse things. And
absolutely.
It's nice.
And especially when it comes to your heart, because it is scary, you know, if you have chest pain or something, you're experiencing a weird sensation, you're like, well, I can't see what's going on in there. What's going on?
Exactly.
So we hear a word thrown around a lot these days, atrial
fibrillation.
Fibrillation. Okay, it's hard for people like me to say. So AFib is short, is what I hear. So talk to me about that.
AFib, atrial fibrillation, is actually a very common disease. It affects millions and millions of people, and it's more of an electrical disease than anything else. I have a little spiel I give to my patients, and I can do it for you if you want.
Yeah, sure.
Basically, there's a top half and a bottom half of the heart. And the normal heartbeat is boom, 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 top, bottom, like this.
Okay.
And it's rhythmic all your life. However, atrial fibrillation is when the top half, or the atrium, instead of beating, it fibrillates, which means it's just jiggling. It's kind of like a seizure. It's kind of like an electrical storm going on the top half of the heart. And when it's seizing, the bottom half doesn't know what to do, and sometimes it speeds up, sometimes it slows down, it's very irregular, things like that.
Okay.
So basically, you think of it as an electrical storm in the upper part of the heart, because the normal electrical activity of the atrium, the heart, is actually being disrupted for some reason. And there's a whole laundry list of things that can cause it, and part of why you see a cardiologist is, first of all, to treat it, to try to keep the heart from going too much out of whack, maybe try to get the rhythm back into normal, which is called sinus rhythm, or you just try to find out why it happened and can we reverse it? Can we stop the disease process?
All right. Now, will a patient know that they are having AFib? Will they always feel it, or is
Nope.
it just sometimes?
It's sometimes. Some people are very asymptomatic, meaning that they don't have any symptoms at all. They don't feel their heart beating fast, they don't feel out of breath, they don't feel chest pain, and their heart rate could be 140, and they're just walking around feeling fine, and it's not uncommon to see that. But there are some people that as soon as they flip into atrial fibrillation, they feel it. They're, oh, I'm tired, I can't breathe, or wow, boy, that feels funny, or I'm having chest pain. So it's very variable. And
Wow.
I think it just hit the microphone, sorry.
That's okay.
It's very variable. So, everybody's a little bit different. So
Okay, so let's talk about a few of the symptoms and a few of the treatments that come into play with AFib.
sure. The main danger of atrial fibrillation is not actually the heart rhythm problem itself. Now, when people feel terrible when they have atrial fibrillation, what we do is we put them on medications to slow the heart rate down. Because like I said, when there's a storm going on up here, the bottom is being bombarded with all these electrical signals and it doesn't know which ones to listen to. So the heart rates can go actually quite high. So we put people on medicine like a beta blocker or a calcium channel blocker, classically, and those keep the bottom half from going out of control. Aside from that, if they feel terrible when they're in atrial fibrillation, we can try medications that will convert the heart back to sinus rhythm. We can actually bring people into the hospital, put them to sleep, and run an electrical current through their heart called a cardioversion and try to reset that heart rhythm. We can go all the way down the path in treatment to something called an ablation, where they put catheters in through your veins and arteries in your legs, and they actually find the extra sparks of electrical activity in the top of the heart, and they can burn those and cauterize those to stop it.
Okay.
And it goes all the way on to sometimes people need a pacemaker even. So I always tell my patients that atrial fibrillation is a moving target. It's always changing, it's developing, it's degenerating, it gets better. People are all over the place on that spectrum. So
Yeah, I have a family member who has been dealing with it. So I find it interesting because for the longest time, her blood pressure has always been high. Her heart, started racing and just beating so fast to the point where she was feeling exhausted. Now it's her heart rate is low. So it's finding that balance to help a patient feel good.
Yep.
So, all right. Well, let's talk about stress tests because we hear people getting those a lot these days. So what's entailed with a stress test?
Again, that's kind of a loaded question. That's a complicated question. There are many kinds of stress tests. And the way that I like to tell people that are new to learning about stress tests is that there is a stress and there is a test. The stress is how we make the body work harder. How do we make the heart work? Do we speed up the heart rate? Do we change the vascular dynamics in the heart to change blood flow? Things like that. And that can be as simple as walking on a treadmill. When you walk on a treadmill, put a little bit of an incline on it, your heart rate speeds up because you're exercising. And the test could be something as simple as just keeping you on an EKG. And we watch the EKG and we watch for changes. We can also take pictures of the heart with an ultrasound. That's called a stress echocardiogram.
Okay.
And we watch for how the wall motions are moving, how the ventricle squeezes, how the pump works. If one of the walls kind of die out during the stress test, that one's struggling. And so we have to assume that there may very well be some blockages there. No blood means no oxygen, no food for the muscle. So it goes into, it basically conserves its energy by stopping contracting or slowing down, things like that.
All right.
Then there's also nuclear medicine stress tests where we have tracers and we have cameras that the nuclear tracer attaches to the blood cells and it flows to the heart muscle and it makes the heart glow on a camera, and we have lots of ways.
Lots of ways to look inside
That's right.
and see what's going on with the pump.
Yep, and even if you can't exercise, we have medications that can make your heart beat faster. We have medications that don't make your heart beat faster, but it changes the blood flow. So I jokingly tell people, I said, we have ways of making you talk. So.
Oh, okay. Well, that's good to know. So if you're watching and, you know, you are experiencing some of these different things, then there's all these tests, all these medicines that are out there to help you feel better. So you mentioned EKG and then you said echocardiogram. Are they the same thing?
Nope. An EKG is actually, it's a piece of paper, and what we do is we put stickers in certain places on your chest. And what that is reading the electrical activity of the heart through the body, and the stickers are actually electrodes that are reading that electrical activity through the chest wall.
Okay.
So that's just a picture, it's a visual representation of the electrical activity of the heart. And it can tell us some certain information. An echocardiogram is actually an ultrasound. If you've ever seen an ultrasound of a baby inside the uterus, it's exactly the same thing, except it's not of a baby, it's of your heart. So we can actually see how thick your walls are. We can see all of your valves, how the valves are working. Are they leaking? Are they tight? How well does the heart squeeze? How powerful is the heart squeeze? Lots of information. So
All right.
they're very different tests.
Okay. Now, there's these terms: heart failure, cardiac arrest. What are they the same or are they different? And how does somebody know if they're experiencing that?
Well, cardiac arrest is arrest. That means the heart stops beating. That one is not difficult to notice,
Right.
because that one is,
That's a big
that
problem.
one is right. That's, a lot of people say that's the drop dead heart attack. I mean, and it happens, unfortunately. But a cardiac arrest is your heart stops beating, and you know, that's where CPR comes in, and that's why it's important in a community like ours, and even in the college community at EIU, that people should be trained in CPR. CPR, bystander CPR, simple CPR done properly can save someone's life. So that's a very important community service that the hospital and the medical organizations actually supply to our public. And if you want any information on that, you know, if they call the hospital and ask for classes, we have classes through there. So cardiac arrest is something that is very noticeable, very easy to notice.
Right.
Congestive heart failure, CHF, congestive heart failure is actually where there's two kinds. There's one kind where the heart is very weak and it just doesn't squeeze. And I tell people that the normal heart squeeze is like this. It's a powerful squeeze. But congestive heart failure, systolic heart failure, is when the heart is struggling and it's tired and it's weak, okay? Now in that situation, your blood isn't flowing like it should. So you can get swelling in your legs, you can get fluid in your lungs. When you're walking upstairs, you get really tired. Some people have chest pain with it. Some people just can barely go from their couch to the bathroom on a daily basis when it's really
fatigue.
bad. Yeah. There's another type called diastolic heart failure. That is basically the heart squeezes fine, but it doesn't relax. And this is very common with folks that have long-standing high blood pressure, people that smoke, people that have abused drugs in the past. That's why all of these things are important to the hypertension, diabetes. Those are important to control well to avoid problems later on. That's why they call it the silent killer, because you don't feel it, but it has its effects. And it will stiffen the muscle of the heart. So it squeezes fine, but it doesn't relax. And the relaxation is just as important to let that blood flow in for the next heartbeat. So symptoms of that are basically the same as congestive heart failure. You can fill up with fluid, you can be tired when you walk, you know, things like that. So basically, shortness of breath, whenever you're exercising or exerting yourself, if you're really having trouble breathing, chest pains, swelling, things like that, those are signs of both kinds of heart failure.
All right. Let's talk about cholesterol.
Sure.
And you know, is that what builds up inside of the valves, or
inside the arteries?
Arteries, okay.
So cholesterol is something that is necessary for life, you know. In fact, your brain and your nerves are made out of cholesterol. So it's essential for existence. You have to have some cholesterol. The problem is when you have a lot of cholesterol, especially a lot of the bad cholesterol, think of it as, you know, your artery is this open hose and you're just slapping down butter on the artery wall. Okay? And it's just getting mashed in there, and over time it builds up and builds up and builds up, and now you have this big thick layer of butter inside your artery, and it's clogging it off. And it's
allowing the blood to flow through.
Exactly, and that's when people need stents, people need heart angiograms to look at the arteries, and if we can put a stent in, we put a balloon through that area, blow up the balloon, the stent holds the artery open, and you can restore blood flow to a struggling artery.
All right. Now the angiogram is where the balloon goes in?
The angiogram is when we actually take pictures.
Oh, okay.
We try to go through the wrist as much as possible because it's more comfortable. But if we can't get through your wrist, and we float a catheter up into the top of your heart, if we can't get through your wrist, we can go through the leg because it all leads to the same place. And what we do is we take this little bitty catheter, put it in the arteries that feed the heart, and we squirt a little bit of dye in there. And then we can see the arteries. That's called an angiogram. Now, when you put a balloon in and put a stent in, that's called angioplasty.
Okay.
So it's
lots of
it's
different
like,
terminology.
oh my goodness. Yeah, there's whole classes on. My wife was actually a medical transcriptionist while I was going through medical school, and you know, she had books and books that she had to study dictionaries for. It's just a language. It's kind of like when you go to your mechanic and you know he's talking about things that you don't understand. It's just a language. It's the names of things.
So I hear people saying a lot, I've got high cholesterol, I've got cholesterol problem, and I eat healthy. What am I supposed to do? Because this is hereditary. What do you tell people in that situation?
I have a hereditary high cholesterol as well. And the problem is, you know, we live in America. If all of us were vegetarians weighing 125 pounds, we wouldn't have this problem as we do now in our society.
But there's so much good food
to eat.
There
is so much, and you know, don't get me started because I'm actually one of my hobbies is cooking. And when I was in rehabilitation after my accident, I just really got into cooking, and I love cooking. So I am fully aware that you know there's good food, and I sometimes don't apply to the cardiac diet myself, but. There is it's basically not necessarily the cholesterol that you're eating or taking in, it's how your body processes it. Because there could be people that exercise every day. You always hear the stories. Person in great shape, they exercise, they run 7 miles a day, they're perfectly healthy, and then they start having chest pain or have a heart attack and they have blockages all over the place.
Right.
Well, that's because their body is processing the cholesterol in an abnormal fashion.
Okay.
And you know, our test, whenever your doctor measures your cholesterol, they're looking at a level, just a number. It doesn't totally tell the whole story because it's far more complicated than that. But if you do have high levels or if you have a bad family history of heart disease, that puts you at risk for heart problems due to the cholesterol. So those people, of course, for the first several months, we say, look, get on a good diet, start exercising because that will drastically lower your cholesterol. Weight loss, diet, exercise. First line therapy, do that. Many people can get their cholesterol under control. But that's the hard thing to do. You know, that's a very difficult thing to do. So what we resort to if that doesn't work or if that can't be accomplished, then we put people on medications.
Okay. All right. And speaking of medication and blood pressure, people have high blood pressure, they have low blood pressure. And sometimes people have high blood pressure and they don't know it.
Yep.
So talk to me about that.
Well, again, like we said before, that's why it's called the silent killer. You know, you don't feel blood pressure. Sometimes when it's really, really high, people will get a headache. You know, they sometimes, we're talking really high. I trained in Chicago, and there's people walking around Chicago with blood pressures 220 on the top number, 150 on the bottom number, and they've had that for years and they're walking around. Now, just because they don't feel it doesn't mean it's not unhealthy. because it's causing damage. It's causing damage time after time. Every heartbeat that goes through is pounding those organs. So we try to keep the blood pressure down to avoid the complications later on down the road. Kidney failure, kidney damage, eye damage, heart damage, stroke, things like that. And so we try to keep people's blood pressures controlled. We try to keep them under control so that they can avoid the complications later on.
All right, so that's high blood pressure. Is low blood pressure dangerous?
It can be, and it depends on the patient. I have, marathon runners that come to my office and their heart rate is 35 and their blood pressure is 70/40. That's perfectly fine for them. They're very conditioned for that. Their bodies are conditioned to that, and they have no symptoms. Now, if my blood pressure was 70, sorry, I just hit the thing again. If my blood pressure was 70, I'd be dizzy and on the floor, probably the same with you.
Right, yeah.
But some people live there, so for them, it's not a problem. But when people's blood pressures go too low, maybe they're taking too much medication. In the elderly population, it's very common that they're not drinking enough water, that they're not keeping their blood pressure up, or they're on medicines that make them get rid of water, like people with congestive heart failure. We try to take that water off, and sometimes you can overshoot. There are sicknesses that can cause low blood pressure, infections, heart failure, heart attacks, all kinds of things. So every answer that is asked about medicine and treatments and what is this, the answer is always, it depends.
Right, because there's so many variables.
There's so many variables, and that's why, that's why it takes 15 years to become a physician, because you have to be able to look at all those different variables and say, is this good or is this bad? So.
Okay. Now, speaking of bad, if somebody is experiencing chest pain when they're walking, what do you suggest they do? Do they stop, sit down? What's the protocol?
The protocol is, if you're having chest pains and you have not been seen by your doctor, you definitely need to contact your doctor about that. If you are doing something that is causing chest pain, stop doing that thing. It's the old joke, doctor, it hurts when I do this. Well, don't do that,
Right.
But there is some validity to that. If you have a blockage, if you have, let's say, one of your blood vessels in your heart is 90% blocked, as long as you're sitting down doing nothing, your heart doesn't need a lot of blood flow to make that heart beat. But if you start walking upstairs, that heart has to beat harder, faster, speed up. It requires more oxygen and more food, and that's drawn from blood flow. So if you have a blockage that's really bad, every time you do that, every time you exert yourself, you're going to run out of blood, and your heart's going to say, oh, you better stop.
Yeah,
So
listen to it.
So listen to it, yes.
So we have a couple of minutes left.
Okay.
What's new and interesting in the cardiology world these days?
My goodness, cardiology is one of those fields that is constantly moving and changing. We are, at Sarah Bush, our cardiology coverage is provided by Prairie Cardiovascular, which is a company that's based in Springfield, and we have several cardiologists, and they're actually a center for cardiac catheterization, for valve surgery, for open heart surgery, things like that. Just in the last year, I've had patients have something called a TAVR, which is T-A-V-R. These are people that have severe aortic stenosis, meaning the valve between the heart chamber and the main vessel of your body, called the aorta, that valve is really calcified and stiff and tight. So it's really hard for your blood to get out and feed your body. So what this is it's a catheter-based approach. Instead of 10 years ago, they would have to do open heart surgery to change that and fix that valve. Now they can go through your leg, through the blood vessel, put a valve in there and blow it up kind of like we do an angioplasty with a stent. But there's a valve in that stent, and you have a brand new valve. And now you can live your life, and you can walk upstairs, and you can play with your grandchildren, things like that. So that's a wonderful technique. Another technique that I've had a couple of patients have is called minimally invasive valve surgery. And instead of doing open heart surgery and changing a valve, they can do it through a little cut about that big.
Good
and they use microscopic equipment they can change a valve, changes people's lives. It's amazing. And there are dozens and dozens of other things. So
that's just a couple right there.
just a couple that I've experienced in the last few months.
Good to know. Well, thank you so much for joining
Absolutely.
us today. Lots of great information.
Thank you.
And we hope that you have enjoyed this episode of Being Well. We'll see you next time.
Production of Being Well is made possible in part by
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.